The S.I.B has been very helpful in creating different applications to follow with surveillance. I believe a lot of it has been highlighted already, but I just want you to know that a lot of it does come down to surveillance and how we want to manage the cases. We do know that in countries that have managed to curve that or flatten that curve, there's a lot of technology behind it. But the technology behind it in itself is what do we do with surveillance? How do we use the surveillance behind that to actually further identify those cases, isolate those cases, test them, and actually start the mitigation process. So indeed, there were different applications that came out that we did that we are using. I guess just to highlight some of the few that we do know of, we have, for example, to go back to when we're talking about contact tracing and these individuals are doing it on a manual basis. Along with S.I.B, the creation of a persons under investigation mobile version was created. This now is a version that they can actually go out and do contact tracing of those individuals under investigation without the use of paperwork. Ideally, what it does, that after you do a contact tracing, that kind of information that is being collected can be gathered, and once it is synced or synchronized at the end of the day or whenever you have the Wi-Fi available, we here at the ministry will actually get it in real time. The S.I.B also facilitated, along with the team here, the creation of the dashboard where we could follow those individuals as well in real time. The EOC here that was created, the operations center here, was receiving calls. I mean, in the beginning there were hundreds of calls that were coming in, and to do the triage of individuals that would be coming in as well, that was something that was being looked at. Again, we reached out to S.I.B to see how we could make it easier to get an application of how individuals would be calling in and be triaged so that they can actually be tiered or triaged into different groups. That was something else that we looked at, and now it is created. We also been working with the S.I.B to look at another component for surveillance that we used in preparation for other health. I guess it is for health systems, and see how the bed capacity that we'd be using. It has been finalized I guess a week ago, to see where we are. What I'm talking about is a modeling aspect, to see a modeling interface that has been created to look at when we have outbreaks again, and to be able to give a forecast of how the situation might look like in the country.